As a practitioner of Chinese medicine, I see many low back pain patients. Low back pain is the #1 reason people seek acupuncture. It is a well-known fact that acupuncture can give excellent results for this complaint. Before we talk about acupuncture, let's talk about low back pain from a Western medical perspective. Even here, low back pain is not well understood. There are many reasons why you may have this disease. Here are some. Disc degeneration or spondylosis. This is where the spongy disc material between the vertebrae that create a cushion effect throughout the spinal column become worn out as we age. Spinal osteoporosis, which affects the vertebral bodies themselves, where they become porous and lose their density. Bone spurs, or growths on the spine that become so large they impinge the nerves. Over time, this can lead to a condition called spinal stenosis, or a narrowing of the space between the vertebrae. This can cause nerve pain, which can shoot down through the buttocks, down to the legs with tingling and numbness as well. We commonly refer to this as sciatica pain. And prolapsed discs, where the material inside the discs breaks through the wall of the disc, putting pressure on the nerves. Most of these problems occur at L4, 5, and S1 because this is where the thinnest part of the disc wall is. If you suspect that you have any one of these conditions, consult a neurologist. He or she can diagnose this kind of disease with various imaging techniques. Another very common cause of low back pain is due to a condition referred to as chronic lumbar ligamentous strain. This is a very general term which applies to an array of ill-defined group of conditions having to do with the soft tissues surrounding the spine. Here, the muscles are not providing proper support to the ligaments. In TCM, the cause of pain can be due to external causes, such as trauma, cold, wind, dampness, or heat, or internal causes of stagnation of qi and blood and deficiency of the kidney or spleen organ systems. In chronic cases, we would treat the root of the disease by choosing points on the corresponding organ channel system. For instance, for the muscles not holding the ligaments in place, we would use points on the spleen because the spleen governs the muscles. Or, in the case of osteoarthritis, we would use points on the kidney organ channel because the kidneys govern the bones. Other TCM pathologies for low back pain include retention of damp cold and stagnation of qi and blood. After a thorough history of the patient is taken, we will use the 4 diagnostic methods of inspection, listening, smelling, inquiring, and palpation to make our diagnosis. Once the diagnosis is made, we select our treatment principle. For instance, in a case of qi and blood stagnation, our treatment principle would be to move the qi and blood. There are many acupuncture techniques we can choose to treat low back pain. We can use local points or Ashur pain points on the affected channel. Or we can use Zangfu organ points to treat the organ deficiency as stated previously. We can use distal points and opposite channel points as in Master Tong's acupuncture methods for pain. Or we can use a technique called the balance method developed by Dr. Tan. There is another system called the muscle channel therapy developed by Dr. He for sports-related injuries. All can treat low back pain effectively, whether acute or chronic. Find out which method we'll use in our case study coming up in our next segment, but first this.